to wait just a little bit longer to give everybody an opportunity to get logged in. But while we're waiting, I want you to know that you are muted. We've muted you so that your conversations don't broadcast for everyone to hear. But even though you're muted, there is a questions box that you can use to type in any question you might have today. And we will try our best to send you an answer or address your questions verbally at the end. I will, let's see, like I say, I want to wait just a little bit longer to give everybody an opportunity to get logged in here. Thank you all so much for joining me today, though. And again, today we're going to talk about the eligibility solution. So if you guys are ready, we can go ahead and get started. You should all see my screen on display, I believe. Can you all see that there? And again, remember, you do have a questions box that you can use to type in any question today, and we'll try to send a private answer back to you. All right, well, let's go ahead and get started. We're here to talk about the eligibility solution today. So once you've logged in, to navigate to eligibility, you simply glide your mouse across the blue bar at the top and hover over Patient Tools. That's where you'll find eligibility. Just simply click on it. Now you'll see the eligibility screens listed as links over to the right. The first of these screens that I want to show you is the eligibility payer list. So to go to the payer list, you simply click on Payers, and it takes you within the eligibility solution and specifically to the payer list. Now it brings me to the Browse screen, and this is where we can browse through the full eligibility payer list. Just click in this box on the top left and type in either a payer name or a payer ID, whichever you want to use to search with. And notice I typed in Aetna and hit enter, and it pulled up any payers that have the word Aetna in their name. Now if I use a payer ID, just be aware that the results may vary. So for example, it found 8 payers that use the payer ID 60054. As you can see right here. But the bottom 3 don't even have the word Aetna in their name. So just be aware that the results may vary depending on which you use, the name or the ID. And you can also search using your state name too. Now, over to the right of the name, it'll also tell you if the payer requires enrollment, yes or no. If there's a no there, then you could go ahead and start submitting those inquiries right away. If there's a yes in this column, then that means that you do need to get that enrollment activated first. So if you have any enrollment questions, you'll definitely need to let us know. But if there's a yes there, it means you do need to get enrollment activated before you can submit inquiries for that payer. Now if there's a notes icon here, you can click it, and it just pops up some extra detailed information to pass along to you regarding that payer. And to the right of the outbound format, it'll show you if that payer allows dual clearinghouse enrollment, yes or no. So if there's a no there, that means they don't allow you to be enrolled with more than one clearinghouse at the same time. So if you see a no there and you are already enrolled through a different clearinghouse, you would need to terminate that past clearinghouse enrollment before you can get enrolled specifically through Zirmed with the payer.
Hey, Karen.
Yes. Oh, yes.
Hey, real quick, this is Shane.
Hey.
I just wanted to, hey, everyone. Hey, I just wanted to chime in and say that, you know, that's one of the roles that we feel here. So if these types of topics confuse you a little bit, know that that's what we're here for, and that we'll do most of the heavy lifting other than signatures when they're required, that type of thing. So, okay, Karen, sorry to interrupt you.
That's okay. Thank you, Shane. Well, that's perfect. So absolutely, any questions about enrollment, reach out to Shane's team there at VisionWeb, and I'm sure they're going to be happy to help you. All right. Now, also notice that we could drill down by payer type if we wanted to. For example, if I just want to see the commercial payers, I'll remove this payer ID and click search, and now it's displaying the commercial payers. Okay, 1,042. Now, I could download this data to a spreadsheet if I wanted to. Just click this button, or if you want to see any changes that have been made to the payer list, just click Updates, and it will show any changes from the last 90 days. So as we go through and activate new payers occasionally, we'll give you a heads up right here who the latest payers are. Sometimes we have to deactivate some, and you'll see payer deactivated if that's the case. So that's how you can browse through the payer list. Any questions about the payer list overall for eligibility? Again, if you have a question, just go to that Q&A, that questions box, go to the questions box and GoToWebinar and type in your question there, and we'll be happy to address that for you. All right. Well, the next thing I want to do is talk about some settings. If you're brand new to using eligibility, there are some settings that will be set up together, but I want you to be aware of a few of them specifically. Under settings, this is something that would be done in the beginning, but I want to specifically mention the service type settings. There are two different ones here. This one is where you go to set up your preferred defaulted service types, so that when you go to submit an inquiry, it will automatically show the service type codes that you've asked it to default to. So this is where you can set up your defaults. It brings me to the default screen. I can set up defaulted service types for manually entered inquiries, or for those that are uploaded in a batch file, or for any that you send using web service. So let me show you how to set up manually entered defaults. All you do is click this link, and it gives you a drop-down box showing all the different service types in a long list here. I'm going to pretend I'm a DME provider just for an example. I can choose that service type DM as my first preferred default. If you have a need for multiple service types, you can keep clicking the link to get another box so that you can choose another service type to be defaulted. Keep clicking it and choose another, however many you need for it to default to. If you want to remove one, just click the red circle.
This is an improvement over our previous solution in that once you do this, you wouldn't have to wade through 50 different service types. You can put in your DME, your office visits, essentially professional services, that type of thing, and those would be your options.
Perfect. Thank you. And so once you have your preferred default set, you'll want to be sure to save changes at the bottom to store those. Now, I want to mention in the drop-down list there is a service type, number 30. It's called Health Benefit Plan Coverage. This one is an automatic default. For example, let's say there's a payer that doesn't allow for any of these other more specific service types. At the very least, the system is going to automatically default to number 30. So for that reason, you don't want to put number 30 as one of your preferred defaults here, because as it states right here, for payers that do not accept other service types, number 30 will automatically be applied. So you don't want to set up 30 as a default. Now, if you plan to submit inquiries in a batch file, you can click this box to state so, and then you can choose to use the same codes that you selected up here in manual entry if you choose this circle. Or if you click Use Different, it gives you the link so that you can choose different codes. I'll just pick something different there. Again, you can set up multiple ones if needed. Now, once you make your selections, you will need to answer one of these two circles. Do you always want it to use the codes that are below, or only when the service type is blank. I'll say always, and then again just save changes. So you can set up completely different service types if needed for your batch uploaded inquiries, or you can use the same ones that you have above. And web service works exactly like this batch area does. So if you do web service, you can set those up as well. Now, all these defaults that I just selected are going to apply to all payers. But what if there's a payer that I need a completely different default set up for? It's a little unique. Well, over here is a green button where you can add a specific default for a certain payer. Just click the green button. It pops up this payer search window where you can search for the payer by name or payer ID, and then just hover and select the payer that you want to set your default for. Click Add Payer, and it adds that payer to this drop-down. Okay, so notice when Cigna is highlighted, I now have blanked, the screen is blank, so I could go through and set up my defaults that are specific for that payer. Okay, maybe I'll put a couple of them here for that payer, just 12 and 18, and then save that. Okay, so again, all three apply: batch, web service, or manual entry. Just set what you need for that payer. If you want to remove that payer, just click Remove Payer while it's displayed here. Now that's great. It lets you set defaults for a specific payer, but we also have this STC wizard that takes it a step further. This is a great tool because not only will it let you pick a particular payer, and it will also show you if there's any service type codes that we don't recommend that you use, or any that we do recommend that you use. Okay, so it gives you the recommendations as well. So when you click Use STC Wizard, it pops up this new window, which is the STC Wizard, and it's a three-step process, as you can see. The first step is to pick a payer in your specialty. So in this box, I'll put in a payer, say, oh, I don't know, I'm just going to pick something like Aetna. Just type in the payer name or payer ID, and then notice the payer or whatever you typed in will display in red from the payer list. So you can slide down and choose the payer that you want. If you want to view notes about that payer, just glide over that Payer Notes button. See how the notes pop up? So you can read those specific details. Then in Specialty, type in your specialty. I'm pretending to be a DME provider, so I'm going to type in DME, and then it pops up in the drop-down, so I'll choose that as my specialty. Those are both required. Taxonomy is not required, but it may give you more accurate results if you do include your taxonomy. If you do not know your taxonomy code, you can click this link, which would take you out to the NPPES website, where you can find your particular taxonomy code. Now with the drop-down, it shows DME taxonomy options here, and I'm going to pretend I'm an oxygen equipment supplier, so I'll click on oxygen. And that is all there is to step one. I'll click Continue. Notice step one options that I selected are listed up above under step one. Now if I need to edit something, just click the blue words and it puts you right back in that mode where you can make a change to any of those three options. And notice now we're on step two, where it shows the STCs that we recommend. We recommend 12, 18, and DM. And you can choose the ones that you want to actually use. So you just select the check boxes. It also shows down here if there were any that we don't recommend, that payer doesn't support. So you can avoid those. But when you're ready, just click Continue, and it takes you to the next step, the third and final step. Be aware if you need to go back to step two, you can click the blue words to get back there. But here in step three, it's saying, okay, where would you like to use those selected STCs? In your manually entered, or your batch, or your web service. I'll just say manual entry, and then you just add STCs, and this green banner lets you know that you successfully set up those defaults. Now in this drop down, not only do I have all payers in Cigna, which I set up with the green button, but it also has Aetna and my defaults for Aetna that I set up using the STC Wizard.
Hey guys, again, I want to tell the group that any of this setup admin work, you know, you can pitch us, and with answering a few questions, we'll jump in and do the heavy lifting. Again, that's what we're here for. So I know a lot of this can get confusing, despite Zirmed's wonderful interface, and it's making it as simple as it can be. It still can be confusing. So know that, again, know that this burden is not placed on you. Our desire is to remove that burden from you. So please feel free when if you gather up what you want, and you can send it to us, and we'll do this setup if you're having problems with it. Okay, Karen.
Perfect. Thank you, Shane. That is awesome. So at least you've had a glimpse at what it can do, and if you need, like Shane said, some help getting that accomplished, definitely reach out to them. Okay. One other service type real quick before we move on and submit an inquiry is there's also a setting here to set your service type display. Now on this screen it shows a long list of all the different service types again, and this is where you can designate, when you get your responses back from a payer, which ones you would prefer to be collapsed, in a collapsed mode versus expanded. So if there's a check mark in the box, it means it's going to be collapsed on the response. So basically what you could do is, go through this list and look at all the different service types, and when you get to one that you would want to be expanded automatically, just uncheck the box. So if I'm a DME provider, I'm going to uncheck both of those. Slide on down, here's another DME. And I always recommend that everyone uncheck number 30. That's that one that it automatically defaults to if a payer doesn't allow for any other service types. And that's where your coinsurance and deductible details will be. So slide through the whole list, unchecking any that you would want to be expanded. So I'm going to uncheck number 30, DM as well, and then just save changes at the bottom. Now, if you want, you could copy these same settings to any other child accounts that you have very easily by clicking that link. So that's the service type display. So those were a few housekeeping things I wanted to mention that can be set up in the beginning, and then you can kind of forget about them unless you need to come back and tweak them later. But definitely reach out to VisionWeb if you need some help with any of those settings or have questions about them. Now let's go on to inquiries, and I'll show you how to submit a new inquiry. This inquiry screen, as you can see, has 19 different inquiries listed here. These are sample ones on my training account here. It shows us the date and time, which user submitted the inquiry, the payer, the patient or subscriber name, the eligibility date, and they'll all have a status. And you'll have the ability to edit one or view the response again. But how do we submit a new one? Well, you simply click the orange button in the top right-hand corner. Just click New Inquiry. It pops up this new eligibility inquiry window, which I'll make a little bigger for us here. And if you subscribe to the Patient Center solution, you could type in a patient's last name and it would gather information from the Patient Center, but you don't have to use that. What you can do is just come on down here to select a payer. Now it remembers the payer that I used last, so it will keep that populated. If I don't want that payer, I can click the X to remove it. Otherwise, type in a payer ID or a payer name, and it will pull up the listing again from the payer list based on what you typed in the box. So notice it found on the payer list all these payers that use that payer ID. Well, if there's a payer that you would use routinely, click the white star and it puts it up at the top in the quick list area. This is like a favorites area so that you can easily go and select that payer and it fills it in, and that way it's at the top of the list, easy to get to. Now, the provider will automatically be filled in. If you have multiple providers, just use the drop down to choose the one you want. The plan date will pre-fill in. Group number is optional. Notice there's no asterisk next to it, but it could improve the response that you get if you do include a specific group number. Just keep that in mind. And notice 12, 18, and DM are automatically defaulted because I set up those as my defaults in the settings that we were just at. Okay, so those service type codes are automatically there. If I want to remove one, just click the red circle, or I can change one, just click the arrow and it gives a list of service types that that payer allows for. Now, not every payer is going to allow for this long of a list of service types. Some might only allow for 5 or 6, okay? I mean, some may be less. That part is driven by the payers. We're just providing to you at this point the service types that the payer allows for. So once you have those in there, notice, by the way, you can add another one if needed. Just click Add Code and then choose from the list the one that you want. Again, click the red circle to remove though. And then I'll glide on down to the next section, which is patient information. Depending on the payer that you selected up above, you can maybe choose if the patient is the subscriber or if they are a dependent, if the payer allows for dependent searches. Otherwise, choose the one you want and then tell it the information that you want to supply down below. With this drop down, you can choose from the list of options what information you want to supply. So I'm going to put in the subscriber ID and I'll punch it in right here. And then now that's not a real one, so I do expect my inquiry to fail, but I want you to see the process. So I'm going to go ahead and click Submit Inquiry, and it's waiting for a response from the payer. And notice how quickly it came up with my eligibility response window. Now when you see the red bar, that's not a good thing. It's letting me know that it failed at the payer. So that's pretty much what you need to know, but down here it gives a little more information as to why. Now I'm going to close out of this failed response and take you back to the inquiry screen so you can see that the most recent inquiry that I submitted that failed at the payer is on the top row. Okay, now if you glide over that failed response, it gives you a little more information. And if you want to go back and view the response again, you can click that response link. But let's take a look at someone who has a good response. Richard Smith has Cigna. And he has active coverage. So let's check out his response. Just click the response link and it pops it up for you. Now what I need you guys to know is every single inquiry that's submitted, we assign a unique inquiry ID number to it. Use that if you ever need help or have questions about an inquiry. You'll want to reference that ID number. Okay, so it points right to that particular one. Now notice this response has a green bar, which is good. They have active coverage. Then down further, as you can see, it shows the coverage details. Here is where it will show the user entered information. So this is all the data that was supplied on the inquiry when it was submitted. They used number 30 as the service type. And then further down is the payer returned information. So this is info that came back from the payer system. If there's ever a discrepancy between the two, you'll see a yellow highlighted bar letting you know what the discrepancy is. Also, if this payer was aware of any other payer coverage, it would show that information right below in between here too. And I can show you an example of that in just a little bit. But as I slide down, notice number 30, health benefit plan coverage, pops up, and it's already expanded with the details on display, because remember under settings I suggested that we uncheck that box to have it automatically expanded. Well, I can collapse it by clicking anywhere on the bar and all those details collapse. Click it again to expand it. So it shows in-network, out-of-network, individual, and family. Okay, now here's DME equipment or DME purchase. Since I had that one automatically expand, it's open as well. Go on down and open up any of them that you want to. Now, if they don't have benefits, that's something that you may see non-covered. Okay, don't pay attention to the color of the bar. It doesn't mean that they do or don't have benefits based on the color. Okay, also sometimes people ask if it will display if authorization or certification is required. It depends on the payer and if they supply that information, but you may see it in that area for example. So as you slide down, again, all these service types are based upon, driven by the payers. Whatever they supply is what it will display here. Now, I'm at the bottom of the screen and I can slide back up again, or I could just click Return to Top, and that takes me right back up to the top of the screen. Now, we could print this page or make it a text version first before you print it, which looks like a typed page, and then print it, or go back to HTML version, which is the colorful view. Okay, so that is your response. Now this would go on and let me submit another new inquiry, or this would let me edit the one that I'm on. I'm going to close out of this. This response is a whole separate window, so I'm going to close that window, and it takes me right back where I was, where we clicked on Richard Smith's response. Another example I want to show you is Molly Dahl's response. Let's click it. She has an example of the yellow highlight where the date of birth was different between the date of birth that was supplied on the inquiry and the date of birth that the payer had in their system. So that's what it looks like when something's not the same. And Paul Hall has Medicare. Let's look at his response. He has an example of what it looks like when a payer is aware of other coverage. It'll show you that information right here before it goes into the service type information, right under payer returned info. Okay, so I'll close out of that one. Now your responses will remain on the screen here for up to 1 year. It tells you that at the bottom. They'll be retained for 1 year. You don't have to keep these responses on here that long. When you're finished with one, you can check the hidden box and click Save Hidden Status, and that will tuck it away behind the scenes. You can always unhide one or redisplay hidden items. If you check in your search filter box here, check Include Hidden and hit Search again, and that will redisplay any hidden inquiries, okay? Anything that's been hidden in the past. Now again, you have all these other search filters that you can use. You can type in an inquiry ID and hit search to go right to that inquiry. And you can change the inquiry date range. Let's say, or just know that you can push the date back to 1 year. Remember, that's as far back as you can go. Or you can click Custom to put in a specific date range, as long as it's in the last year. Now you may not see same or similar on yours. That's a separate feature that we would have to turn on. That's typically for providers who supply equipment or supplies. So you won't see that on your screen unless we've turned that on. One more thing I want you to notice is, you can click the response to view the response. You can click the Edit button to edit the inquiry that you submitted. Just click on Edit, and it pops it up again so that you can make any changes, and then click the Resubmit button. Also, you can click the Status, and it pops up a history window. This is where it's going to show all the events that happen with that inquiry. It shows the date, the time, and pay attention to the source. Was it ZirMed or the payer? Now something I want you to know is when you submit an inquiry, if for some reason the payer system doesn't respond to it in a timely manner, then it may time out. And your screen will tell you that it timed out due to payer non-response. If that happens, you will see an event on your history window here saying that. And what I want you to know is we will automatically resubmit that inquiry that timed out on your behalf an hour later. So we will automatically resubmit it again an hour later for you. If the payer still doesn't respond in a timely manner, we will resubmit it again up to 2 more times at different time intervals. So a total of 3 times we may possibly resubmit it for you automatically at different time intervals. And you would see all those events listed here. And here on your history is another place where you can find that inquiry ID. Again, why is that so important? Well, because if you need to refer to someone at VisionWeb to a particular inquiry, you can paste that inquiry ID number here, click search, and it'll take you right to that one inquiry. So you can definitely refer to one with that ID. So where do we see those ID numbers? The inquiry ID. It was 2 different places. Do you guys remember where? Does anybody remember? One of the places was on the response in the very top left corner, and the other place was in the status when it pops up the history window in the top left corner. Okay? All right, so that's basically how the eligibility screen operates. There's one more link here at the top that we've added for convenience. This is a link to one of the 2 reports that you can get on the report screen. But we've added a link to it right here to make it easy to work your failed inquiries. So if you can go through here and look at all your inquiries with a particular status. Maybe I want to see all of them that are failed at the payer, or failed for enrollment, or failed at Zirmed. You can choose a status and then hit search to focus on just that group that have that status. But another way you can view your failed inquiries is to click this link, and it takes you to the report screen where you see you're on the failed inquiry dashboard report. This report does not include hidden inquiries, but you can choose what you want to view data for, your whole domain. What do I mean by domain? Well, if you have multiple accounts up at the top in the drop down, that you do billing for, that's the domain. So if you want it to view data for all your accounts, leave it for domain. If you're only interested in the account that you're on at the top, then that's what accounts will let you do. So notice it filled in my account right there. But if you want to view data for multiple accounts, click in this box, start typing in the account name, and notice I can choose all accounts again, or I can choose one of these other accounts that I want to view data for. So I'll click in here again and type America again, and let's say I want the DME account. And then I can choose the failure date range. How far back do you want to see the failures? You can go back as far as 30 days. So that's how far back you can see your failed inquiries here. Now you can choose how you want to group them. I'll group mine by failure message, and then I'll generate the report. And as I slide down, you'll see it found 4 inquiries that have failed in the last 30 days, and they're sorted by failure message because that's what I chose, and they're only for these 3 accounts based on those 3. So you can see the failure messages, the quantities for each one, and if you want to drill down further within one, you can choose a grouping there. And notice each one has a checkbox. So if I wanted to, I can select some and then download their data to a spreadsheet. Just click Download CSV to do that. So that is your failed inquiry dashboard report. Now back at inquiries, does anybody have any questions about the inquiries screen overall or anything at all? Shane, is there someone that's answering their few questions that are popping up?
No, we didn't, because we wanted to wait for you to go through everything. We didn't know what you would be able to answer.
Okay, you got it.
And through it, and then we also think that some of these questions are better answered by you.
Oh, okay. Well, I'll try my best to kind of read through them and address any that I can here.
Yeah, we'll do it together.
Okay. Let's see here. Somebody asked, what is web service? Well, basically, if you have to ask, you're probably not using it. Web service is a way for your computer to dial into our computer to submit your inquiries. So in a very basic terms, that's basically what it is. Let's see.
That's more of a, I would say, a kind of corporation to corporation,
right.
transaction that normally occurs. So it's
yes.
not something that you normally would do at a practice like that.
Okay. Okay. Good. Yeah, it's computer to computer. A human isn't necessarily involved in the submitting of the inquiries. Let's see. Do we have to use the default services? You mean the default settings? You don't have to. I definitely would recommend it to make your life easier, but you don't necessarily have to, I guess.
On the service type themselves, on the service type, if Monica's talking about that, if you set up, say 3 or 4 service types as default, do the other ones still display underneath it and they can pick it, or no, they're excluded completely? Say that someone doesn't put physician office services on their default service type when picking the benefit, type of service.
Are you asking me? I'm sorry, I'm confused. So
yeah,
are you asking me? Okay.
Yes, I am. So
okay.
when someone picks the default service types,
okay,
do they have the option of going back, and when they're actually requesting benefit, are the other service types displayed just underneath somewhere? That way, if they, for some reason, needed a different service type, is it available to them?
So even though you set up your defaults under settings, when you go to submit a new inquiry, the defaults will display, but you can remove one or change them if you want to by selecting something different, okay, or add a new one on the fly during that particular inquiry, okay? So they can be modified during the actual inquiry, but the default just makes it easy for them to be there initially, but you can certainly change or remove them.
Okay. I think that's what Monica was asking.
Okay. All righty. Sounds good.
Can we start setting up this information even if we're not ready to send claims yet? Karen, I'll let you that one.
I mean, as soon as you have a login, you could go to settings and start setting those defaults up. Absolutely. If you're comfortable with that and you want to do it on your own.
They don't have to be live to do that.
No. As soon as you have a login and you are, as long as you can get in there and you have permissions for the solution, to access the solution, then you should be able to get in and do that, yes.
And I'll say this as well. Everybody on the webinar, if you've submitted your initial test file that we discussed last time, you're going to be live in short order if you're not already. So, that's happening at a very rapid rate now. So if you have not sent us a mapping file, then different story. We can get it from you. But if you sent it, then it won't be long before we're telling you you're live.
Perfect. Okay. Yeah, and I'm sure Shane wants you to know, if you have not sent a mapping file, you'll definitely want to try to get that in as soon as possible. Give us that test file so that we can make sure everything looks good and get you going. Okay, the next one was, is there a place for vision? I'm thinking that question was back when we were on a response, maybe?
I'm thinking service type. It's service. They're talking about the service type.
Under settings, you mean, or?
Yeah, go back to the service types.
Okay. All right.
If that's not right, Missy, let us know. But I'm pretty sure that that's. I'm sorry, Kim. So sometimes it's under routine eye, sometimes it's under vision. I think this is something that's dictated by the payer themselves and will differ based upon their settings. Well, that's how it was in the previous solution that we had. So there's like, for this particular payer, there's vision right there. Other times you may find it under eye care. Would you agree, Karen?
Honestly, I'm not as familiar with the eye care specific codes. There's BR for eye. You know, you guys know more than me on what the actual codes should be. I honestly am not familiar.
Yeah, it'll differ by the payer on what service types, how they display it. That's my experience with it. So
yeah,
the default settings here will be useful in that, so you can find it one time and then be done with it, not have to wade through all that every time.
Yeah, I mean, for your all payers, you could go through and pick all the options that could potentially be needed, and then when you go to submit your inquiry on a new inquiry, you could just simply remove the ones that you don't want at that moment, So it's completely up to you there.
Okay.
And remember, under settings, if you have something unique for a certain payer, use that STC Wizard window. Use this to help you see the codes that a particular payer recommends or doesn't recommend. Okay. Somebody says clear as mud. Uh-oh. Well, definitely, if all this doesn't make sense, you'll want to give Shane and his team a call. Yeah, I'll let them know. Yeah. Okay.
We'll help you, Monica.
All right.
Let's see. What's our next one? Okay, I'm trying to do this as we go along, but under new eligibility inquiry, it will not let me drop down a payer.
Ah, okay. Let's see.
Would that be an enrollment issue? Okay.
The drop down won't work if it's blank. For example, if you don't have anything on your quick list, it's not going to drop anything down until you specifically start typing something in, and you'll see the suggested results. So, for example, my quick list is rather long, but you would need to type in a keyword or a payer ID. So I'm not sure if you were already doing that or not, but if you were just simply clicking the drop down and you're brand new without typing something in, then it may be blank. It may not show anything until you tell it what you want to look for. Okay.
Very good. Great. Let's see. What's the next question? If you go up, there we go. Let's see.
That's Monica.
This makes any type of. Okay, Monica. Okay. How do you go about getting a login? Joy, if you haven't, if you don't have a login, just email myself or Anna. And if through the course of the years you haven't had your own login for some reason and you were using someone else's, then just drop us a line and we'll set you up. How will we know when we are live, and how will we be contacted about it? So if I'm going to answer two questions with this one. If you submit a mapping file, and this is for you, Rudy, when a mapping file is just the initial claim file, just like you send every day. It's just the first one that goes through this solution through Zirmed, and we take that first one, and the computer looks at where all the data is on that file, and then from that point forward, it knows where to look. So we need that initial file in order to, going forward, to make the program understand and how to read your data. So once we get that file, it gets mapped, and that's not a long process at this point. We're getting pretty quick at it, and Zirmed is awesome, much quicker than another company to remain nameless. And so once that gets mapped, then we're told that it is indeed mapped successfully. We've already told Zirmed that if an account is mapped, make it live. So before there was some back and forth between our two companies, but we've got a standing order that if it's mapped, to turn it on, make it live. We are told on a daily basis now which ones have gone live, and we'll be making outbound calls. And I think we've got 50 to call today. We have 50 accounts to call and tell that they're live. So it's happening rapidly, and so you should be getting a call from us, a call or an email, telling you that your account is now activated and ready to go.
Super. Good deal.
Hey, let's see. I don't, Ann, I'm not sure what you meant.
I think, yeah, we found the AL. We found the AL, which was Vision, in the default listing. So I was just showing that too. So I think he was just responding to that.
Okay. Michelle, I have 2 questions. I was unable to attend the first webinar. How can we view the previous sessions? They're recorded, and I'm not sure. Are we mailing them out or putting them out there on? Okay, okay, after the, okay, so we'll make a note, Michelle, and they're all going to be sent out after they're complete on the 17th, but we'll go ahead and send you the first one prior to that. We have it available to us, do we not, guys?
Yeah.
Okay, so we'll go ahead and send it to you, Michelle. We'll make a note and send it to you. And second, Winter, how are we supposed to be sending in a batch file? I've been uploading claims to Zermed as requested, along with Imdion, since we were notified to do so. Well, then I'll probably be calling you or emailing you later today and telling you your account's live if you've done that. I am confused by the last statement about when we will receive a login because you would have logged in. Let me back up. Your login to quote-unquote Imdion is also your login to Zermed. It's just that third tab. When you go to payer transactions up at the top, the third tab over says Zermed solution. And so once you're into, yeah, that'd be awesome if you don't mind.
Okay, you got it. Yeah. Let's see.
And so you don't have to get a separate login for this. You're likely already enabled to look at it and just didn't realize the now if you've been submitting the file as requested through that link right there that says upload your claims, then likely you're part of this group that's been mapped, and if not, you're going to be mapped in very short order. And yeah, that's it. So right up here, you go to payer transactions, and the third tab over is new Zermed claims. And so you should be able to click that link and get into the solution. If you're not, let me know.
We take you right in there. Yep, okay. We take you right to the dashboard. Perfect.
Okay. Let's see. Can you log in through VisionWeb? Yes, you absolutely will. And those other 2 tabs will go away on February 1st. When we get the email call, we have instructions on login and site. BJ will be, yes, you will. If you have any additional questions to what we have gone over today, but feel free to email and call us. Again, that's what we're here for. We're live, but we hadn't had a successful batch go out. We are calling for help. I'm still waiting. Who can help us? Missy, Anna, or I, or a lady by the name of Donna. One of the 3 of us will be calling you today. Okay, good, cool, BJ. And you, Erica, as soon as you're live, start using it, is my advice. Reason being is the less data you push through the other system, the better. You'll have you're going to have ongoing access to this system. So, you don't want to. The least amount of data you can push through the other one, the better. When I go to Zermed, it pops to a page saying I'm not eligible to view. Okay, Angie, we'll get on that and give you a call. And just in case, Angie, your name is not listed in our records, but you have a login, Angie, I'm assuming. If you don't have a login and you're using someone else, email us your practice name, okay? And otherwise, we'll be able to find you and we will get it fixed for you and then reach out to you. We have to file our medical claims. I still need a mapping file. Yes, you still need, they would send a file, just, yes, Rudy, you would. Still need a mapping file to get this solution before whoever is doing that for you. If you have an RCM company that's doing it, they'll still need, cool, Angie, they'll still need to send a mapping file. Erica, can I use the Vision Web login? Yes. Erica, what is mapping? It's just it's where the some of you submit claims. I'll try not to get too technical here, but all of you import data. Some of you, some other clients use what's called a DDE solution, and that means they literally type in every piece of data. Maybe they're not using a PM system, OfficeMate, Crystal, whatever, and so they literally type in everything. You guys are kind of a step above that, where y'all are importing claims, and you don't have to do all that data entry work. But because you're importing it, the computer has to be told where to look for the data. So that mapping file is where Zirmed tells the program where to look for the data. So once it's mapped, then going forward, it reads your files correctly and everything moves along. Okay, what else? Should everyone in the office have their own login? That would be anybody accessing it. The right answer is yes. Now, in reality, I know a lot of offices do not, and you have turnover, and it's you end up using somebody else's. But the answer is yes. Everybody using it should have their own login.
And it's not only part of our security, but it's for your own security as well. That every user have their own login. It's just a really, really recommended thing to do.
In the previous solution, there was really no difference in one login to the other, so there wasn't a whole lot of motivation for people to go, follow that rule other than the security issue, But with this solution, say that, you had two individuals working on your claims. You can assign the claims to where one individual has 50% of them and the other one has 50% of them. You can divvy it out like that, and it should be by login. So yeah, that's right.
Yeah.
So you do have some reasons functionally to have those different user IDs. That's one of the big improvements. This is just overall, it's more robust, and there's notes and ways to organize things that just didn't exist in the previous one. But that particular aspect of it for practices that have more than one individual working in the system, and the fact that it scrubs it with these LCDs, NCDs, and CCIs that we've added, those are really big improvements. Okay, where are we at? I think if you've covered this, but what if Indiana is gone on February 1st? Will our past claims info come through Zirmed, or how will I have to deal with claims that need adjusting and resubmitting? Thank you, BJ, for throwing that one over the plate for me. When you look at visionweb.com, and Karen, if you don't mind bringing that back up,
oh, sure.
when you look at that login page right there, that little orange button that says upload your claims, what we are asking you to do is not only the first file, but every day as you file claims until the end of the month, do it your normal way through Indion until you're live, and then and upload it to that little orange button. And the reason is that if you take your files and push them through to that button, then what we will do is take all of those old files, those legacy files, if you will, and push them through Zirmed. We've already worked out with them so that they're going to catch them and make them, quote unquote, reject, because we don't want them to go through to the payer. But that process will put the data into their system and allow you to go back and edit it at a later date. So that's key to it. Now you can grab all the files you want and push through that thing and send them to us. If you want to go back and grab the last month's worth of files so that they're there, that's great. Yeah, that's good too. The more data you put in there, the more data you're going to have access to after the fact.
Mm-hmm.
How do we pull a mapping file off of Crystal? It's the same file, Rudy. It's the same file you submit every day, no different. And in fact, that's the point. We just want a regular file. Is there anything specific to do before I start going live with Zirmed? Send us that mapping file. There's a theme there, huh? So that's really it. And then you're doing what you need to do, which is attend these webinars and educate yourself. I'll be able to create one for the other person. You guys are going to give that person one. Yeah, usernames. We create all of the dependent usernames. So Erica, we would. You just send us what you need. I've already done the mapping, but I've not prepared any of the things that are being discussed today. Okay, and if you need help with that, that's what we're here for. Okay, and it's a new product, and we'll definitely jump in and help you. Okay. These are great questions. I really feel good about having these webinars and having this discussion with everyone. I wish that all of our clients would attend these webinars because I think they've been very useful in clearing up some of the ambiguity in this process.
Yeah.
Anything else? Anybody? 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 You sound like Bueller. Okay.
Well, if you like,
go ahead. Thank you for tuning in today. And Karen, go ahead.
I was going to say, if you like, I'll go ahead and talk about batches, and then we can wrap up more questions at the end. Yeah. So.
Yeah. Okay. I didn't realize we had more. Oh.
That's okay. It's okay because a lot of this was good stuff to get out there. So, but some of you listening in may be planning to upload your inquiries in a batch file. I don't know if you are or you aren't, but if you are, this batches screen is where you would go to upload a batch file of inquiries. You know, you can enter them manually on the inquiry screen, but if you have a file that you want to upload, you come here to batches. So you go to your system and create your file first. Then come here to batches and click upload batch. It pops up this window where you would choose when you want us to process your file. Now, when you submit an inquiry manually, we process it pretty much immediately, as long as the payer system is responding. However, when you upload a batch, some people like to upload a batch for tomorrow's patients or the day after that or the next day. You can choose a future date if you want to. So let's pretend I'm uploading this batch for tomorrow's patients. I'm going to choose the process date as tomorrow. Then I would use Browse, click that button to go out inside my system to my C drive or my desktop or my F drive, wherever in your system your file has been stored. You go browse and find the file, and when you find it, you just simply double click on it, and that'll fill in the file name right here in the file name box. And then you would just simply click upload. And when you do, when you upload, it puts the most recent batch on the top row here. So it'll show you the date it was submitted, and every batch gets a unique batch ID assigned to it by Zirmed. Just like every inquiry gets an inquiry ID, every batch gets a batch ID. It shows the name of the batch that you gave it, and of course it shows how it was uploaded, and it shows which user uploaded it, and it'll show you how many inquiries are within that batch. Now initially it'll just say processing while the batch is uploading. You do have to wait for complete to pop up there before you know it's finished processing. But if you, for example, if I upload this batch for tomorrow's patients, what happens is Zirmed will hold on to those inquiries until after midnight. So once that date rolls around at midnight, then after that is when we would submit the inquiries to the payers. So you don't have any future date issues. Now the next morning when you come in, you would want to generate the response file, and you do that simply by clicking this Generate Responses button. And then you would click Go to Download, which would take you from batches to downloads, that next tab over. So if I click Go to Download, it takes me to the download screen where you can see I have 5 different download files listed here. So these are the files that have been downloaded with my responses in there. So what you would do is click the download button to download the responses. So, this piece of it is something that you may be like, wow, what is all this? Especially if you're not planning to do batches. Don't freak out. If you do plan to do batches, I'm sure that you'll get this information again at the time you do submit your first live batch. But just know that there's the process there where you would generate the response file and then go to download and click the download button. Also, know that you can archive a download file. That's not something that you would you can archive a batch, but that's not something you would typically do if it's a good batch of inquiries. So know that there's check boxes there where you could archive multiple ones if you wanted to, and of course you have your search filter options over here to search through the batches. But that's basically how you upload a batch. Now there is a little name matching that you might need to do, and unfortunately my training account doesn't have any payers waiting for name matching, but if you saw, well no, let me go ahead and pull some up. I'm going to go to a different account because you guys haven't seen this yet. Name matching is what I refer to as a housekeeping task. Name matching for claims is the same process for name matching for inquiries. Let me get some ready here for us, okay? Here we go. So eligibility name matching, specifically payer name matching, is just a housekeeping task where, you know, when you first send over a brand new payer name in a batch for the very first time, we don't know where you want us to send those inquiries based on that name, because we're not going to assume just because BCBS is in the name that you want it to go to Blue Cross Blue Shield of Texas, for example. Name matching gives you the opportunity to tell us exactly where you want your payers' inquiries to go. This box on the right shows the payer names that you submitted that are brand new, and this would be the quantity of inquiries. So payer name matching, which is what I'm on right now, is 4 very easy steps. And I want you to know that the first step would be to click on your payer name that you sent over that is brand new. It automatically appears here, and your dashboard screen will tell you if you have something that needs name matching. But step 1 would be to highlight that payer name. Step 2 would be to search for that payer, and you can do so by clicking in Name Contains and type in either a keyword of the payer name or the payer ID. But here's another hint for you. If it's a Blue Cross Blue Shield or a Medicaid or a Medicare, type in your state name and search using it, and that way you may get a shorter list to choose from. It'll be easier to find the payer you want. So what is it pulling up over here? Well, that's the payer list. Remember the first thing I showed you was the eligibility payer list? Well, that's what it's pulling up here based upon what you searched for. So here's Blue Cross Blue Shield of Texas, SB 900. If that's the payer I want this payer's inquiries to always go to, then step 3 would be to click in the appropriate circle. Another hint for you, always be sure you look to the right here to confirm you're picking the right payer ID and the right delivery that you want, because sometimes the delivery may say paper or it might have a different payer ID. So be sure you're choosing the one you want. But after you select one, then you just hit Match to Selected Payer, and notice that BCBS disappeared out of the box. From now on, we know exactly where you want that payer's BCBS's inquiries to go. But any new spellings that come over, you have to name match those as well. Again, we're not going to assume just because BCBS is in the name that we want it to go to a particular payer. That's the whole point of payer name matching. It gives you that ability to pick and choose which payer you want your inquiries to go to. So if I want it to go to the same one, I'll just click Match again, and that one, from now on, we would know where to send them. Now, if there's a payer that you never want us to send out the door, like this blank one, you can match it to trash. Matching to trash tells us to never send any inquiries out the door to that payer. So when you match to trash, you get this little warning letting you know we will permanently delete current and future inquiries that you submit with that name. Just click OK, and we will now never send anything out with the name blank that's spelled that particular way. So your goal is to get this box empty. So you would continue on name matching everything, and if you want to see what you've matched in the past, come down to the bottom and check this box, and it'll show your payer names that you sent over on your inquiries. the payer name you matched it to on our payer list up here, and the payer ID and delivery. And the red ones, of course, are ones that have been trashed. Notice the delivery says none, no delivery. Everything will be discarded. And they all have an unmatch button. So if you ever want to, you can go up or click unmatch, then go up and check this little box. Think of this as your rematch box. If you check it, it redisplays that payer or any other payers that are not currently matched yet. So you can go through the 4 steps again, highlight, do a search, click in an appropriate circle, and match or trash, whichever you want to do. And this red warning is just saying to uncheck that box when you're finished. So that's what name matching is. So it's just a little housekeeping task. And that's basically batches. And one more thing I want to point out, and then we can go back to wrap up any additional last-minute questions. But this reports tab, I mentioned that there was the failed inquiry dashboard report. You can get to that from the top of the inquiry screen with that link. But the other report you can get is your billing report, and that will show you totals. If you have a domain of multiple accounts, you can choose the scope to be the whole domain or just the account that you're on at the moment. And you can choose the grouping and how you want it ordered, and then you choose the activity date range. By the way, if you click custom, you can put in a specific date range as long as it's within the last 2 years. Then you can choose to see the 4 submission sources as separate columns or not. I'll go ahead and choose to display them there, and you can drill down to some specific filters if you want to. Then you can generate the report on the screen or download it to a spreadsheet. I'll generate this one, which I have no data. Sorry, I have no data. But it would show the account names, how many inquiries were uploaded in a batch, how many were direct data entry or real time, for example. And if we slide over, you'd see how many were resubmitted or how many total. In fact, let me go back to this year and click generate again. Nope, still no data. Let me try last year. I'm sorry, it's just that my demo account has such limit. Oh, there's one. My demo account has limited data, but it is showing the account name. 0 inquiries were uploaded in a batch. 35 were manually entered. And if I slide over, 0 were real time, 0 were edited and resubmitted for a total of 35. And if you did put in a specific filter item, it would list the filter topic right there. So whatever you choose in this area, you would be able to tell what's reflected on that report by that corner there. So that's the other thing I wanted to mention was your billing report. And that's basically all the screens there, guys. Any other questions? Yes, ma'am.
This is Anna. If you could answer the last 2 questions.
You got it. Let me see here.
1103 and 1104.
Okay. This is okay. The question is this for checking eligibility or submitting claims? I'm confused. I thought we reviewed batches under claim submission Tuesday. Well, you know what? You're exactly right. You do have, if you're subscribing to claims, you have the ability to submit claims in a batch, or if you're subscribing to eligibility, you may be planning to upload your eligibility inquiries in a batch. They both have a batch feature. It's up to you guys whether you use it or not, okay? So, but the feature is there.
I think that's basically an improvement on the previous solution as well, where you had to enter them one by one. It was technically there, but it didn't really function that well. So now if you have it in the right format, and we'll have to look and see exactly what that is. Maybe it's a delineated file or a CSV file, but you could upload an eligibility inquiry in mass as well.
I'm sorry, guys. I'm moving around. Let me go back to the account that I was in before I started showing name matching. So give me 1 second here, and I'll be able to continue on. Okay. All right. So back at eligibility inquiry. So like I say, you can submit them manually or use batches, either one. And the next question is, let me read it real quick here. Oh, okay. When you perform name matching for claims, it's separate from name matching for eligibility. So there are two different name matchings. Okay, you can't do name matching for one assuming it's going to automatically name match in the other. They're two separate places. But eligibility name matching, primarily you're just going to name match those brand new payers. With claims, then first time you upload a batch, you're also going to maybe need to, name match your providers the first time as well. So provider names will be listed on the left, and your provider name would be here, so you could name match it or add it as a new provider name. So they're completely separate. So if you get a rejection message that says you need name matching, you may see that on your dashboard. For example, right here, I have one institutional claim that needs name matching. So you may see something like this under your Action Center giving you a heads up that you've got some name matching that needs to be done, whether it's to name match a billing provider or a rendering provider. So any brand new spellings of either a payer name or brand new spellings of a provider of some type, they may show up as needing to be name matched. So if you've already name matched a billing provider name or a rendering provider name, but it comes up again saying it needs name matching, it's because it's spelled differently. So each new spelling, the system will prompt you to perform name matching for it. Okay, and you don't have to create a brand new provider for each provider that you name match. There's an option there to click in the circle next to the one that you already matched on the left, and you can name match it to one that you've already name matched previously. I hope that makes sense. Does that help, Missy? Yeah, if not, definitely someone can walk through that name matching piece with you, I'm sure, one-on-one, but I'm hoping that helps out and answers your question. If not, you can let me know. Was that the two you wanted me to hit, Anna? Let's see.
Yes.
Okay, perfect.
Let's see what else we've got. So we had a comment that the videos okay, we're good and helpful. That's great.
Okay.
Okay, and yeah, we'll make the webinars available to everybody. And if anybody is confused, we'll be there to help you and guide you through anything, So.
Absolutely, because a lot of what I've gone over you haven't actually seen yet, so definitely they'll be able to help you through it.
Yeah, try not to get too stressed out. We're going to be here for you.
Yeah. All right, well, the next training is next Tuesday at 11 o'clock Eastern Time. That's 10 Central, and it's over the remit solution. So we'll talk about the remit payer list and how to handle electronic remittances that come in through Zirmed. So definitely, if you haven't already registered for that, you'll want to do that. Did you want to give...
I'm sorry, Karen. Stepping over on your feet. I was just going to say, we've been doing enrollments for everyone that's opted in. Vast majority of our users. And so you may have noticed that your payments that are showing up in Imdion seem lower than maybe they traditionally have. And that would be because we're doing these payer enrollments and the data is starting to flow through Zirmed. So this next webinar will be very useful. So if you don't already, if you hadn't poked around and found it, then on Tuesday we'll be showing you where you find it and where they all are.
Yeah, perfect. And I was just going to mention, do you want me to give out the email addresses for Anna or yourself for them?
Yes,
they need
absolutely.
the email? Yeah, Anna's email is Romano, that's AROMANO @visionweb.com. And Shane's email is sshepherd, that's SSHEPHERD @visionweb.com.
Correct.
Okay.
Thank you. Thank you.
You're very welcome. You're welcome. Well, guys, I want to thank you all so much for attending today. I don't see any new questions coming over. Does anybody have any last-minute questions? If you do, please go ahead and type them in now. Otherwise, if you feel like you've gotten everything you needed for today, Shane, if you don't have anything else to add, I'll tell them that they could go ahead and log off by clicking the X in the upper right-hand corner. Somebody says, no, see you on the 17th. Well, thank you, Erica. We'll see you then. If you have, like I say, any last-minute questions, go ahead and put them in there now. Otherwise, thank you all so much for your time and your attention today. And I'll see you on the 17th.
We'll be reaching out to many of you to let you know the status of your account. And you're welcome to proactively email me, and we'll respond to you in that way as well, if you want to know about whether your account was one of the 50 that went live yesterday. We're expecting a pretty good number every day, so this is going to roll through very quickly, and if you've submitted a mapping file, you'll be live before you know it.
Yeah, that is the key, isn't it, Shane? To definitely get those mapping files, or test files, I'm used to calling it, get those in as soon as possible so we can make sure everything is lined up and in the place that it's supposed to be on your inquiries, so that when you start submitting them live, you won't have issues regarding that. So definitely get that in as quick as you can, and we'll take a look at them.
And thanks to everyone, and thank you, Karen, for doing such a good job.
Thank you, Karen.
You're very welcome. Thank you, guys. You guys have a great day, and I'll see you next Tuesday, okay?
Sounds good, everyone.